I'll be sharing my screen, and today the whole point is to create a PTSD patient using our AI character builder. I'm assuming I see a lot of familiar names in here, so it looks like a lot of these people I know already. So thank you so much for taking the time to join and see what we're about to do today. So the goal of this webinar is to once again create that PTSD patient and just kind of have some fun with it, get some good ideas, and just kind of show how easy it is to create a standardized patient now with the AI. As some of you already know, that's one of our things, is that we really like to build AI patients. We use also AI for the pathophysiology, so it does respond to your students in live time. So it does matter what you say, and it also matters what you do. So before I do start, feel free to put any questions in the chat if you do have some already. Everyone okay to everyone see that on the screen? Perfect, thank you so much. So if you don't know us already, we're Tactile VR. We're a nursing education company and a technology company second. And we help nursing schools and hospital systems scale simulation into their program by using AI and also virtual reality. So it's a combination of both. So everything you do and everything you say actually matters in our sims, and it doesn't require an educator's availability, basically. We won't be, of course, making this into a product presentation. It's more of just today we're going to have some fun creating an AI patient together, and we're going to focus it around making it a PTSD, a patient struggling with PTSD. So, like I said, please, I'm going to have all of you actually be a big part of my creation today. So, put in the chat of what your responses are. I can always unmute somebody too. If you want to provide a longer answer, that's totally okay. You can just let me know in the chat if you'd like to talk. So I'm going to go ahead and get my things set up here, and we'll get started. So let's go on to the next. So this is what we're going to go over completely today. Well, first, we already introduced ourselves. We're going to talk a little bit about what this actually does. So why would we even create an AI patient? What does it really do for nursing? We'll get into that. And of course, we're going to talk about the AI patients and the AI facilitation in general, so that way you at least have an idea of what we're actually doing before we get started. And then the scenario itself, so we're going to talk about, okay, we already have a scenario ready to go that we're going to be building and putting into our library to give to nursing schools and hospitals to use. But you guys are all going to help me make the patient surrounding the scenario that we have. So it's just going to be a little bit of some fun here. And then, of course, at the end, we can do some live demoing with the headset itself. I'll share my screen, and we can all talk to the patient together. So that'll be a fun little ending there. This will probably last an hour. We'll try to keep it shorter if we can. Just depends on how much interaction we get and how much time it takes us to think about what we want to create together. So, like I said, any questions, please drop them in the chat there. So, all right. So I'm going to go ahead and create a character just to get started. And let's go on. So why would we even need AI patients in the first place? Well, there's a shortage of educators, just like there is a bedside shortage. So we are very aware of that as a company, and we wanted to make sure that we made a product that didn't just help your students get more realism and more clinical opportunity. We wanted to make a product that helped you as an educator as well, because it does take a lot of time scheduling, facilitating sims, and of course debriefing sims, where now you can scale this simulation into your program by using AI to facilitate for you. And you still have all the control, but the real reason is that we do have a nursing shortage that we all know about. And if we have an educator shortage at the same time, it will be basically impossible to serve the nursing workforce because we will have a bottleneck. We'll have a capacity limitation at our nursing schools that can't increase their enrollment to really help serve the more nurses we need in the future years here. So we're here to help nursing schools and hospitals really scale that into their program and help get students as much practice as possible before they hit the bedside. So we do that with, once again, AI. We didn't create AI, unfortunately, but we did create a technology that helps you moderate it using AI. So we taught AI pathophysiology. So that's why you don't have to be there facilitating every little thing. So in order for your student to get the response they need to learn. So our simulations will do it for you. And also, of course, we use VR for hands-on training, immersiveness, getting them the real feel, helping them really get in a space where they can feel comfortable making clinical decisions. And then, of course, this product would be worthless if we didn't evaluate and get those analytics you need as an educator and your students, too, to learn from those mistakes they make. So our realism standard, before we get into creating the patient, in case you have not seen our product before, just to get a better idea of what we're actually doing here today. These patients have personalities, they have emotions, they have moods, and we can address any culture and give them the knowledge it takes to display that culture to your students. So everything you do in the simulation is exactly how you do it in real life. It's very high fidelity VR, so there's no menus. That's something we really pride ourselves with, is no menu buttons. It's you and the patient, and just like it is in real life. You're gonna talk to them like you do, and you're gonna intervene and care for them like you do. So this just shows a little quick highlight video of all the little hands-on actions, and there's no animations doing it for you. You have to make the clinical decision yourself. So I assume a lot of you have seen our patients before, but this kind of gives a good context of when we start creating our patient together, just kind of imagine the immersiveness that you get with these characters. It's really no different than creating a digital human being, basically. Just to kind of give you some examples of patients that we've already created before and that our nursing schools and hospitals are using. This will just be a quick little 2-minute video I'll play, and this will actually give me some time to get the setting prepared for the scenario. So have you do is follow my finger with your eyes. You all should be able to hear.
I'll focus on your finger.
Hey Kyle, my name's Will. I'm going to be your nurse today. How are you feeling?
Oh, great. Another idiot trying to poison me with meds. Listen, Will, can you please just get this over with? I don't have time for this.
I'm sorry. What do you not have time for?
This conversation, for one. And all these stupid meds you keep trying to shove down my throat. I know what you're trying to do.
Could you explain more about this labetalol? I'm a bit nervous about trying new medications.
I completely understand. So yes, labetalol is a beta blocker that's going to help lower your heart rate and your blood pressure because you have a really high blood pressure right now, and this is a common medication we use to lower it in a quick fashion.
All right, but please be careful. The thought of my heart rate changing makes me even more anxious. And about the metformin, do you think not taking it recently could have caused this spike in my blood sugar? It's just that traveling to get more medications is difficult for me.
Is it going to feel strange? I've never worn an oxygen mask before. How does it really work? What if it makes me uncomfortable? Can you promise it won't hurt? I'm just not sure about all this.
Can you stick your tongue out?
Shut up! My tongue is none of your business. I can do whatever I want with my own body. And another thing, what are you doing staring at me like that? Can't you see I'm busy talking to the voices in my head?
What's going on?
Well, breath's a bit short lately.
Tell the doc that I don't need his medicine. I have everything I need in my mind. I can control the entire universe anyways.
So there is a quick video there just to show you that we are creating a patient that will be dynamically talking back to us. So when we do our live demo later on after we create the patient, you'll see, I'll get in the headset, you'll all be able to see. And I'd like to, at the end, you guys can type in what questions you want to ask them because it kind of makes it fun there. Just to kind of give a good idea and see if we can fine tune the patient as well, because you can always edit them after you create them to make sure it's the exact thing you want. So also AI doctors, family members can also be taken care of in these scenarios. So that way your students are talking and having a real life conversation. So the other way we use AI is for facilitation. The educator has all the control still, but they're allowing AI to do it for them. So that way they don't have to be there live with every single student every time they go in a sim. So instead of you spending hours scheduling out and facilitating groups of 5 to 10 students, you can have them all come in at the same time or have them come in on their own time without requiring your availability to do the sim that you created. And they're going to make mistakes in these sims. Well, our simulations are going to show what happens in real life. So this video you're about to see is a heart failure patient and a sepsis patient, and we're giving fluid boluses to each one. So as we know, if you have a medical background, you understand that if you give a fluid bolus to a heart failure patient, it's not going to be such a good reaction. If you gave a fluid bolus to a sepsis patient, it likely would be, depending on some specific patho that's going on with the patient. But overall, in a general sense, our pathophysiology will respond to your students' actions no matter what they do and when they do it as well. So here's a quick example of that. Then we're getting right into the patient. All right, Mr. Rodriguez, I have the fluid bolus here with me, okay?
Don't call me Mr. Anything, it's Manny. And no, not okay.
All right, so that just showed you right there that same intervention, but these patients had different conditions that was assigned by the educator. So all the educator had to do is click a button. Instead of scripting it for 5 hours straight, for example, they can just click, hey, this patient has heart failure. Our AI knows how to respond to your student with every med your student gives and every intervention your student does. All right, so that's about enough of the product overview. As I mentioned, a lot of you have seen it already. So the next step is to create this AI patient together. So it's going to be a lot of fun. Just to kind of give you an idea, this is kind of how we're structuring the patient. We're going to first start with, of course, just a core description of the character. And we'll go through all the steps with these slides. But really, these patients, like you and I, have moods they get into. They have personalities. They do have emotions. And they have knowledge. So you give them the knowledge you want them to know about themselves and the situation going on around them. So if we move on, we're going to talk about the scenario. So this scenario is in an inpatient hospital room. This patient is in the hospital because they are having an acute condition going on, but they're mainly right now struggling. The scenario is based around your student understanding how to address PTSD symptoms and how to de-escalate / use therapeutic communication with them. So yes, they're going to be in a hospital room, so you'll see that at the end. So we want the students in this scenario to do a mental health assessment, so complete a subjective history interview with a patient struggling with PTSD. They're going to do some care planning, so they're going to discuss amongst the interdisciplinary healthcare team. So we are going to have an AI doctor in the scenario as well. So we want the student to be able to identify, hey, this patient is struggling with this, and it does depend on what character we create today, so that's still up in the air. And then therapeutic communication. So we want the student to be able to apply therapeutic communication and de-escalation techniques to reduce the patient's distress. So this patient, we do want to make a patient who is struggling with those PTSD symptoms or stressors and such. So just, I'm sure a lot of you already know, but this is kind of the general sense of some signs of PTSD, some characteristics that you should say. They will be detached, or they have separation from others. They have hypervigilance, flashbacks, and depression, emotional numbness. So there's many more, but those are the general sense of what we're creating today. So first step is the core description. So we want to create a history of present illness, motivations, and flaws. So when we say motivations, that means every one of us has motivations when we talk to each other. So to give you an example here, this could be, the motivation could be the patient wants pain medication or they want to talk to the doctor. So we can think of some ideas here together. This is the first slide where we actually are going to start getting some interaction from you all. I would love as many ideas thrown out as possible. I'm going to start looking in the comments, and then we're going to create the patient together. My first question is, we are creating the core description, so what do you want this patient's name to be? Anybody have some good ideas? It could be anything, or I'll just create one as well. But tell me a good first and last name you guys want to do. And this will be the patient we're talking to after we're done creating this patient together. So any ideas, even if it's something off the top of your head, it's totally okay. Or I can create one myself, you guys tell me. Ralph Smith, Alfred, like it? All right. We can do Ralph Smith. Sounds good. So Ralph Smith, we'll make, how old do you want this patient to be? Based off, this is what they're going to look like, by the way. This is the model that we're using. So it is going to be a male, a William Patrick. Nina, that's a very similar. So 53, 47, okay. We'll go on the higher side just because the character may be probably in their 50s, closer than they would be. We'll say 53-year-old male. Okay, we'll just start there. Wants to. All right, let me put some things in here. So now let's get really specific. Anybody have an idea of a HPI that we should put? Like, let's think like if you were to read your patient's chart, and what would be the HPI of a PTSD patient? Now I know that's a lot of typing, but like I said, you don't feel like you have to put the whole thing in. We can kind of bounce off of each other there. Did everyone lose sound, or is it just Amy? Just want to make sure. Okay. Okay. Thank you for letting me know. All right, so let's go ahead and get into Ralph Smith here. Second. And then we're going to ask some specific questions to get started here. Okay. All right, first things first, yes, HPI. So, okay, I see chronic pain, type 2 diabetes, hypertension. So let's go ahead and say, one second, let me fix my computer screen here. There and right. Perfect, okay. Veteran in history, okay, I like it. Let me change this. Sorry, I'm trying to restructure my windows here so they can. There we go. And let's do that. Okay. All right, so Ralph Smith is a 53-year-old male with history of, or let's say 53-year-old male with history of hypertension, chronic pain. I like that. Hypertension. Keep putting ideas in. I'm adding them as you guys put in here. So okay, so type 2 diabetes, I'll put that. Perfect. And I will show you what everything looks like at the end. And you guys will obviously get to talk to the patient too. So, has migraines, okay. Is a veteran. Should we put any information like social history, any alcohol use, are they married, that kind of stuff? What do you guys think? Substance abuse or substance use, alcohol. Okay. Great. Is married. And some people are saying divorced. We have a discrepancy here. Agree with divorced. Okay, we'll say divorced. And we'll say lives alone. Unless you all want a different one. Is divorced and lives alone. And we're going to say some context here. Is in the inpatient hospital room being treated for what? What do you guys want the patient to be? What's their primary issue in the hospital? Any ideas on what we should say? Uncontrolled diabetes? Okay, any other ideas? Fatigue, foot ulcer, pneumonia, all kinds of different. Pancreatitis, pneumonia. So we have 2 pneumonias, we have 2 ulcers, we have 1 pancreatitis. Pancreatitis would be a good one too. Let's see. ETOH withdrawals, that would be all of it. Okay. Liver failure, okay. Let's say, I mean, they can have multiple things, but maybe what their reason for admission was. We can say chest pain. That might be a little distracting if for the objective. Let's just say it's maybe, we can do ETOH withdrawal. I think that might go in with the scenario well. Let's see, alcohol withdrawal. We'll just say that. All right, so we're good. Okay, so just to read off what we have here, 53-year-old male with history of chronic pain, hypertension, and migraines, is a veteran, is divorced and lives alone, is in the inpatient hospital room being treated for alcohol withdrawal. What do we want the patient's motivation to be? So when we talk to this patient, what do you want this patient to really want to talk about, basically? If there is anything, it could be they want to talk to the doctor, they want pain medication, they want alcohol, they want a cigarette, whatever that would be. You guys can give me some ideas. Wants pain medication, okay. They want to feel better. All right. We'll say they want pain medication because they have a headache. And they want to talk to the doctor to discuss why they are at the hospital. We'll go with that. Flaws. So when we say flaws, that means like our insecurities. You want them to be angry? We can do that. I'll show you how we can make them angry. So flaws, insecurities. So it could be, okay, when the nurse mentions this, it makes them angry. When the nurse doesn't do this, that makes them feel insecure. Those kind of things. Yeah. Any ideas there? Any flaws? Irritable and impatient, yeah. Doesn't like to be touched, yep. Okay. I like that. I think that would be good, because anytime we try to do an assessment on them, such as trying to put our stethoscope and listen to lung sounds, then they won't agree. When nurse doesn't answer call button, immediately gets angry, yeah. Is non-compliant, okay. let's say they don't like to be touched. Okay, we'll say they're non-compliant, and we'll get in more detail about their personality here in a second, because you have touched on that already. So let's go ahead and give them 3 adjectives. Let's move on. So we did the core description. We're going to give a dialogue style now. So this is basically, we all talk a certain way. I like that he assumed nobody cares. That's a good one. Wants people to wear gloves constantly. I like that. That's actually a really good, that's a good one too. I'm going to put that in the flaws. So let's do that. So I'm going to put in we'll put in the flaws that they don't like to be touched, and they want the nurse to be wearing gloves at all times. Okay, I like that one. That was a good one. Personality. So, okay, let's get into the dialogue style. So you're basically, let's give 3 words, and let's say, if I were to ask you how you talk, it could be sarcastic. You could be a sarcastic person, or you could be, you're talkative, or you're not talkative. What do you want him to be like? And obviously, if we were to kind of try to give the student a feeling of what it would be like to talk to a patient struggling with PTSD, they might not be so talkative. Mean, yes, cynical. So we could say they're short. They give short kind of, I like the, yeah, mumbles, loses train of thought. Okay, so let's do, we'll say they're short. We'll say, yes. Listen, all right, and then let's go back. Mumbles, loses train of thought. We'll say they're kind of, we'll say they're rude. And yeah, I think that would be good. Rude. And yes, we can say like they lose train of thought. I think that would be a good one. All right. Any common phrases you want them to say? So I always use the example that my grandmother would always have like 3 different things that she would always say, like, you know, like every generation seems to have certain phrases, but anything that you want them to commonly say, and this will come up naturally in conversation. It won't just be randomly. So it could be, for example, when I surprise the patient, they might say, "Oh my gosh," or "Yeah, I like that. Can you just get me some help?" That's good. Stupid is stupid. I like that. It might not apply with this scenario, but I do like that. Pretty funny. Anything else? Okay. We'll just say that they're gonna say, "I need help now," with an exclamation point there, just to bring in some emotion. All right. So next is we're gonna go over is the mood and personality. That's funny. Mood and personality. So you tell me, what kind of mood do you want this patient to be in? Obviously, cranky is a good one. So our options, it kind of works like bipolar moods and bipolar personalities, because we all do have them. So we could say, does this patient fall more on the spectrum of sad or happy? Which obviously we're probably going to say sad. Not really sad, but just, you know, more leaning towards that. They're not happy. They're going to be more angry than fearful, I would assume, unless, what do you all think? Do you want them to be more fearful, or do you want them to be more angry? So when they are actually, so impatient, angry, okay? All right, we have a tie here. Let's see how many, type in fearful if you think fearful, type in angry if you think angry. We need to break the tie here. We have either one. So angry, okay. I think everyone wants angry. That's usually the most popular patients we have, as our mean ones. And then fearful because he's really nice. So next one is disgust versus trust, which we're going to say disgust on that one. We don't really need to vote on that because they're not going to trust the nurse. All right, going back. Next one is anticipation versus surprise. Now, for a PTSD patient, it does make sense for them to be surprised a lot because, you know, the hypervigilance, for example, or it could be, I guess you can make the argument it could be the opposite as well. So what do you all think? Should the patient, when you say something, for example, are we wanting this patient to act like, oh, they could have anticipated that, or do we want them to be surprised about everything the nurse says, basically? What do you think? Surprised, okay. All right, yep, most are saying surprised, that's good. All right, we'll say surprised. Next is the personality traits. So negative versus positive, we're going to say negative. Aggressive versus peaceful, we already kind of said they're angry, more fearful. Now we're kind of actually describing their personality. So this patient's going to be a negative. They're going to be slightly aggressive. And they're going to be more cautious or open. What do you all think? Probably cautious, right? And then they're probably going to be very introverted as well versus extroverted. And how difficult do you want it to be to change this patient's mood? So we have something called an emotional fluidity. So we actually can describe and tell the character how easy it is for your mood to change. Are you going to be mad no matter what the nurse says, or can the nurse have some runway here to change your mood and actually make you feel more comfortable? You're kind of setting the difficulty of the character. Slightly open. All right. Let's say we'll slightly put them on the fluid side, that they're not going to be so rigid where they're not going to change their mood. Because if I do well versus if I don't do well, the character the scenario could go two different ways. All right. So give me three adjectives to describe the character, like the personality of the character. That's the last step here for the mood and personality. So if I were to ask you how to describe yourself in 3 words, what would we do here for this character? Fearful, okay. Put as many as you guys want. Doesn't have to just be a single answer or a single word. You can put as many adjectives as you think. So it could be, once again, it could be sad, it could be, we could say they're hypervigilant, kind of even playing into the PTSD, apprehensive, non-trusting, upset, gruff, okay. Deceitful, irritable, defeated, upset. I like those. That's a good one. Yeah. Okay. Keep them coming if you have any more ideas here. Because we have 3, we can do up to 3. So let's do. Go ahead and like any of the comments that you see too. If you like a certain response, go ahead and like them. Yeah. I do like Karen's quite a bit. Those are good. Deceitful is good. Yeah, okay. We have a lot of votes for Karen's 3. So let's say irritable for sure. Okay, and we're gonna say defeated. I think that's a good one for that kind of scenario. Let's see, a lot of people put upset as well, or 2 did. So we'll say irritable, defeated, and upset, just because of the other responses included as well. So we'll say that. Okay, we're almost done. Last few things is, okay, we have some safety configurations to figure out. Do we want this patient to use profanity? Yes or no? And it could be either mild or loose, and loose means they could be using all of the words. Mild means they might just use a few, general, curse words. But do we want this patient to use profanity? So mild, okay. Or if you don't want them to use any at all, say strict. All right. So mild. And then are we okay with them talking about violence, such as physical violence, threats of harm on themselves or another person? Do we want to ask about adult topics such as sexual acts? Everything okay with that? for everybody? No? Mild on those? It's same options. It's strict, mild, or loose. No one's sexual, okay? Alright. Alright, we'll just do that. Okay, so I put mild for adult topics. We'll say loose for violence because we probably will be asking those questions in this scenario, especially if we're going to go and do any sort of a mental health assessment here. So alcohol, I'll do loose. Substance abuse, we'll do loose. Politics, we'll do mild. And religion, we'll do loose as well. And yeah, I think that will be good. And then profanity is loose. Okay, so last thing is setting the knowledge. So let's see. So think, okay, this is going to be a lot of information here. So this is the most where I need your help, basically. So when we set knowledge, let me move on. And we'll take about 2 to 3 minutes to do this. So put in as many things as you want. So literally ask yourself, like, okay, I know things about my past medical history, my date of birth, my what medications I take at home, or my wife left me because of this because he's divorced, or those kind of like social history things, combine it with what's going on in the scenario. This is where as many responses as we can get, it would be very helpful. So we're basically asking, what does this character know, so they can properly answer it when the student asks the questions. So any questions that your student may ask in a scenario like this, we should be putting it in there, so that way the character knows the information. Or we could make it easy that there's not self-aware, yeah. So it could even be it could be incorrect information, such as they have hallucinations or delusions, so things that are not true you can put in there. Or what he doesn't know, so not self-aware is one we could do. Or for example, let's say the nurse asks a question such as, what medications do you take at home? They may not know that, so we just simply put in the knowledge that the character doesn't know what medications they take at home. So the AI will use this knowledge to then properly answer the questions of your nurse. So start typing away. This will take about 2 to 3 minutes as I kind of look at your responses and put them in. And this is the last step, and we'll get right into the scenario. All right, so go ahead and start typing away. So allergies, yeah, that kind of stuff. Everyone kind of work together on what you want to put in there. So while you're doing that, I'm going to just be typing everything I see here, and we'll go from there. Okay. Okay, so I'm going to go ahead and put the screen here just so everyone else can Okay, I like that. Yeah, and if you like someone else's response, just like it, that if you agree with putting that in. Okay, so okay. So yes, they know their medical history. We're okay with that. So they know they have hypertension, diabetes. They are in pain currently. They're going to want pain medication. So we're going to say they have a severe migraine and they want pain medication. This is the last step, guys, and we're going to get in and talk to the patient. All right. Yes, well, not so. Medical history. Stop taking his medications a month ago. I like that one. Okay. Allergies. So do we want them to have allergies? No, they don't have allergies. They do. Not sure what medications to take home. Does not know what medications they take at home. Heightened knowledge of his military history. I like that. That's a good one. Do they like talking about it though? That's one thing that we might want to consider. But if they do, we can always put that in. Or they don't mind talking about it, not necessarily like talking about it. They have nightmares. Yes, that's good. They have difficulty sleeping. Okay. Reluctant to discuss substance use history. Okay. Angry outbursts, fluctuating mood, history of violence. Do we want them? They don't like talking about their history of violent acts. Doesn't want to talk about divorce, okay. Now, obviously, we would fine-tune this patient after some use and, trialing here, but this is going to be a good starting point. Problems with employment, I like that. Problems keeping a job. Keeping a job, okay. Poor supports, disengaged from other family members. So should we say doesn't talk to family and doesn't have support? Doesn't know family medical history, okay. They do want Tylenol. They're okay with taking Tylenol. Okay. I assume that's what that means. Yes to Tylenol. Is okay with Tylenol. Okay with Tylenol. Self-medicates, binge drinker. Can we have some things positive? Yeah, put some positive things in there. Okay, we do want them to be homeless, okay. No to homeless, okay. Let's start liking and which response you like better, so we can get a vote on that. Okay. So we had 2 against 1 on the homeless, no, 3 against 1 now. So not homeless, okay. Where do they live? If not homeless, where do you want them to be residing? Trailer park. Apartment, hotel. Start liking whatever you agree with. Okay, we have 2 on the apartment. We'll just say that. We'll say they live in an apartment. All right, I think we can just go from there. Anything else important? Last minute, no knowledge. Now, obviously, this isn't going to be a completely in-depth patient, but you guys will get to see what you just made, so that'll be cool. So, any last minute things you want to put in? So, could he have a job? Lives with friend only. Is a friend only support sense of humor? Could. Flashbacks and okay. Flashbacks and okay. All right, so let's go ahead and I'm gonna stop sharing my screen. Loves knock-knock jokes. All right, let's just do that. We'll just do that. Why don't we put in there that in their motivation that they want to say a knock-knock joke or something, just for fun. And I will probably remove that when we actually use this patient. Wants to tell the nurse. We'll see what the AI comes up with too. That'll be even more interesting. I like that. Wants to tell the nurse a knock-knock joke. Okay. All right. So let me work on. I'm gonna stop sharing. Well, actually, no. We can keep my shared screen here. So we just finished that. So what we'll be doing here while you're waiting on me to get this ready here, start coming up with a list of. Why don't we? You can stay in the chat. Why don't you just put some questions you want to ask the patient? Start listing all the questions you want to ask the patient. I'm going to go off the list I see, and I'll ask him for you. And you'll be able to hear him and everything. So give me a couple minutes to get this set up, and then we'll be in the scenario for about 5 minutes or so.
Finally, someone who can get me some real help. Nurse, huh? Good. I need some pain meds for this headache. And don't even think about touching me, got it?
I promise I won't touch you. Can I at least put some vital sign monitor equipment on you, though?
Good. See that you don't. Now about those meds. How long is it going to take to get some relief around here? Grumble, grumble. Fine. But minimal contact, understand. And don't expect me to be all smiles about it. Just get it over with.
No problem. We'll do it really quick. Are you feeling? You said you were in some pain on a scale of 1 to 10. How bad is your pain?
It's a 10, okay? It's a 10. Can't you see I'm suffering here? Now, can we please move on to getting me some actual help instead of just talking about it?
Yes. What kind of pain medication have you been taking before for your migraines?
I've been taking Percocet. And don't give me any of that stuff about how I might be addicted or whatever. I need it for the pain, got it? Don't think you can just walk out on me like that. We are not done here. I still haven't gotten my meds or talked to the doctor. Come back.
What brought you in today?
I already told you my head is killing me. But if you must know, it's the usual. The booze, the headaches, the whole mess. Now can we move on?
What do you love about yourself?
You didn't hear me. Fine. Let me repeat myself. The alcohol withdrawal. That's why they brought me in, okay? Happy now. Love about myself. Are you kidding me? Look at me, I'm a mess. But if you must know, At least my sense of humor is still intact. Now, want to hear a knock-knock joke or something?
Sure, what knock-knock joke do you have?
Knock, knock. Who's there? Boo. Boo who? Doesn't matter. Nobody cares about me anyway. Happy now.
My goodness. Well, I'm sorry to hear. I don't know if that was really a joke or if that was.
Spare me the sympathy, okay? It was a joke. Sort of. Just forget about it.
Would you like to speak to someone from Pastoral Care Services?
Pastoral Care Services. Are you kidding me? What's a priest gonna do for me? Fix my headache with a prayer? No, thanks. Save the platitudes for someone else.
All right, well, I have some Tylenol for you.
Tylenol. Are you kidding me? That's not gonna touch this headache. I need the good stuff, not that over-the-counter nonsense. Where's the doctor?
Can you lift up your left arm? I'm going to scan your wristband.
Okay.
Name and date of birth?
Ugh, really? Fine. My name's Ralph Smith. Born August 12th, 1969. Now can I please get some real pain meds?
Well, right now I just have Tylenol for you. And I'll call the doctor and see if we can get you something stronger. So we spent some time in there. Sorry for all the difficulties switching it around, but we at least got to hear a knock-knock joke, so I was happy about that. So, any questions, Q&A that can help answer? I know this we've went over. You keep getting kicked out? Aw. So, okay, I'm curious to know if the patient can have more expression. Yes, they can. So we didn't have, obviously we kind of just built a general starting point for the character. So everything you saw there, it can get much more advanced than that. So we can show the patient actually get physically angry, they can have behaviors, all that stuff. But yeah, that was just kind of a general, like, just to show you that we can customize who this character is today. But we can get more advanced every time we have a webinar together. I think that would be fun. So, yeah, good question. Yeah, so you can customize and upload any rubrics that you have. So let's say you did make that scenario and it was about de-escalation. You would have your rubric set and seeing if your student asked the right questions, because you don't even have to be there anymore. The system will be able to track it for you. So if you wanted them to follow a certain questionnaire that you would want them to ask a patient that was struggling with those symptoms, for example, you could have it evaluate them in that way. And you could set the scale as well. So if it's pass, fail, or certain points that it's worth. So yeah, it can be related to Wi-Fi speed, or there are certain points too. I did notice that he was, in the very beginning especially, I had my volume really high on my computer, so he was talking to himself a few times. And then if you kind of like, if you yourself roll and like talk a bunch, because I was talking to you a few times and forgot to mute myself, then it could kind of backlog and he's still trying to decipher what you're actually trying to get him to say, basically. But yes, it could, Wi-Fi speed can very much delay it, but we do recommend you do like at least 10 megabytes per second. So just to get a good, because a lot of the responses, as you saw, a lot of them were pretty quick, but there are some times where if you do have some outages, then yeah. Thank you, Nina. I really appreciate it. Any other questions I can help? I did see there was a Q&A earlier in the meeting here, so okay, so I'll go over this, Tammy. I'm not sure if you're still on here or not. I think this has the potential to prepare our students to interact with VR patient scenarios related to specimen collection. I'm wondering if the capacity to expand this beyond patient avatars. As a non-nurse, non-medical educator, I'm curious about the potential to create IPE VR experiences or laboratory-related VR experiences that are lab-skilled focused. This is potentially, I mean, it's possible. That's something that we could always have a discussion about. We truly partner with every institution, so yeah, that could be something, yeah. Thank you, very interactive. Yes, thank you. Thank you all so much for taking the time, and there will be a recording if you feel like watching back at it. But yeah, you all are free to go. Thank you so much. Thank you for taking the time.